Hello. In this video, I will be going over theoretical case conceptualization. So to begin, what is a conceptualization? A theoretical case conceptualization, which is sometimes called a case formulation, is the therapist's understanding of the client's problems as viewed through a particular theoretical orientation, as defined by biological, psychological, and the social context of the client, and as supported by a body of research and practice. Essentially, a certain problem that a client is facing in therapy can be understood or conceptualized in different ways based upon your perspective, meaning your theory, the client's context, their environment, their ecology, and best practice in research and your clinical judgment. When we go over theories in this class, you will learn how to understand or conceptualize a problem according to each specific theory. And that means that the way you understand a problem like depression may differ depending on which perspective you are approaching the problem from. So here's an example, not necessarily a therapeutic example, but an example. So you have a client who comes to you and they are depressed because of the amount of debt they have. And so I have three different perspectives you could come at understanding that problem from. So one perspective would be the person was irresponsible and spent too much money. If that's how you understand their debt and their depression, then your goal is going to be specific to that understanding. For example, in this case, the goal might be to learn how to budget better or to get the client on a better financial plan. Now, if we look at a different perspective, perhaps the person had cancer and they lost all their money due to medical debt. In this case, the goal is very different. It's not necessarily that they can't budget. And so maybe the goal is going to be to consolidate debt or to speak to a financial advisor. And then finally, if the person is depressed and in debt because they were born into poverty and they're trapped in a cycle of systematic oppression, the goal is incredibly different, right? And starts to be more larger scale with breaking the cycle of oppression. And so this same problem, the same person is going to be understood and treated and helped differently based on the perspective that you're approaching their problem from. So the purpose of a conceptualization, well, basically a strong case conceptualization is guided by the use of an orientation that provides a framework for you, the therapist, from which to condense and synthesize lots of different pieces of information into a coherent and well-developed narrative. The narrative then aims to identify not only the cause of the client's problems, but also the forces that are at work, both internal within the client and external outside from the client, that serve to maintain the problem. So this is helping us to understand why did the problem start and why does it continue happening? And we're using all the different pieces of information, the psychosocial history, the mental status exam, experiences of trauma, and so on, in order to understand and create that narrative. This together links a set of symptoms that the client is presenting to a diagnosis, okay? And then ultimately, we use all of that information in our conceptualization to create a treatment plan, meaning your goals of treatment and the way you're going to approach treatment. And this will be primarily based on the theory that you're conceptualizing from. In terms of the components of a conceptualization, there are essentially four. The first is the diagnostic formulation, and this is based on the symptoms that the client is presenting, which are then used to decide or determine what the diagnosis is for that client. This is something you learn more about in your psychopathology class and what you use the DSM for. The clinical formulation attempts to understand how the symptom developed and how it's maintained. So this is where your theory becomes especially important because it will guide you in understanding kind of the theory of human nature and how problems develop and how they're maintained. This is what we'll focus on primarily in this class. Cultural formulation attempts to understand how a client's culture impacts their symptom pattern. And though this is always important and should always be considered when you're doing a conceptualization, you typically will get more of this intentionally in multicultural counseling courses. And then finally, the treatment formulation is the plan of action that you develop toward meeting the goals. The plan should come from how you understand the problem. So from the therapeutic model that you're approaching this from, in order to figure out the best ways to address the goal. All right, so if we look at this vignette, we're going to address one of the more common issues that you'll address as a therapist, which is depression. And we're going to see how we would understand it and treat it, i.e. conceptualize it, based on different theoretical orientations. We'll work through this brief case first, consider how different theories might approach it, and then afterward, I'll complete a really brief conceptualization from one of the most commonly used theories, CBT. So we'll read it first. Abigail has moved in with her father after having a huge argument with her mother. She has a long history of depression and self-injurious behaviors. She is constantly crying, isolates, and feels unmotivated. Her depression has begun to affect her school performance and her friendship with her best friend, Wendy. So here's some examples of the beginning of a clinical formulation according to 3 different theories. The first is cognitive theory. And cognitive theory would suggest that the depression that Abigail is experiencing is the consequence of unhealthy self-thoughts and beliefs. So perhaps one of these thoughts might be, my mother doesn't love me, so no one will. From this perspective, therapy would focus on identifying those negative beliefs and learning how to replace them with healthier ones as a means of reducing that depression. From choice theory and reality therapy, we would see that depression is likely the result of an unsatisfied need. So perhaps the need for love and belonging. So maybe in Abigail's case, she's trying to meet her need for love and belonging by isolating in the hopes that someone will respond to that behavior by reaching out to her, but it's not working, so this need is not met. With that perspective, therapy might focus on identifying that unmet need or needs and trying to satisfy it in an appropriate manner, for example, coaching her on how to reach out to her friend herself. And then finally, from Adlerian theory, human problems in Adlerian theory are social in nature. So depression would be the result of an impairment in a life task, such as the social task, which has to do with friendship. In that case, therapy would be focused on modifying Abigail's lifestyle so that she can successfully navigate her life task. And this might include identifying and restructuring her mistaken beliefs about herself and others that are contributing to her depression. So you can see, same exact problem, understood in 3 very different ways, treated in 3 different ways, perhaps some overlap, but theoretically could help reduce the depression. So it's not necessarily one size fits all. Now, if we were to look specifically at CBT, the symptoms that Abigail is experiencing are the result of maladaptive cognitions, which lead to changes in feelings and behavior. And these relations are bidirectional, meaning that feelings influence behavior just as behavior influences feelings. So in Abigail's case, these thoughts then contribute to feelings of loneliness and sadness and behaviors like self-harming. So an appropriate goal in this case would be increased use of positive self-statements like I am lovable, I am worthy, I am a good friend from 0 times a day to 2 times a day. Treatment interventions might include journaling, cognitive restructuring, and homework assignments. So this here creates an outline, a very brief outline of your conceptualization for the clinical formulation and treatment formulation pieces. And you would then expand upon this in a narrative by explaining each of the techniques, elaborating more with more examples on the connections between cognitions, behaviors, and feelings, and incorporating some research to further explain and defend your treatment choices. So which one is ideal? You could do this formulation with any of the theories that we'll learn about and end up approaching Abigail's treatment in different ways. But to ask which one is ideal is in essence a trick question, because ultimately any approach may work, but you'd want to know more about the client's expectations, research and best practices, your personality, and so on. So by being exposed to different theories, you can have them in your toolkit, figure out which one resonates with you, and which one matches best to your client, and approach your cases from there. It's important to remember that one size doesn't fit all. You need to be flexible in the methods that you use. Don't become so attached to a theory that you use it even when it's not appropriate or when research says that it's not best. This would go against our ethical codes. So although you will gravitate toward one theory, and you'll use that with the majority of your clients, it will be helpful to have other techniques or other approaches that you can integrate into therapy when perhaps your particular approach isn't quite working or isn't being as effective as you would like it to be. This brings us also to another thing that is stressed regardless of the approach that you take, which is the therapeutic relationship or alliance. You are important. Knowledge of theories, techniques, development, etc., are essential. You need to know these things. That's why you're in school. And you're going to learn all of these things over the course of your graduate study and supervised clinical experience, but that alone isn't enough. Research consistently shows that it's the therapeutic relationship, meaning the relationship between you and your client, that has the most powerful influence on outcomes in therapy. The alliance, the relationship, your personal and interpersonal skills, and client agency are very important. This means that we do need to do some serious self-reflection as therapists and evaluation if we're going to be able to present our best, most helpful selves into the therapy room. If you have issues that you haven't worked through, they're going to come out in the therapy room and they're going to affect your efficacy. And they're probably going to affect the relationship that you build with your clients. And knowing that the relationship is the most important, this can be really problematic. So you need to know who you are, okay? Before you can learn about theories and pick one or many, you need to know what you're bringing to the table. It's like picking a partner. You need to know what you're bringing to the potential relationship before you can really accurately evaluate what the other person is bringing and whether or not you're compatible. This includes awareness of your unexplored personal blocks, traumas, fears, biases. Otherwise, as I said, you're bringing them into the therapy room and they are going to affect your relationship and your efficacy. These are some questions here that you may want to go through and try to figure out what the answers are for yourself and what are areas that you could potentially work on. Okay, so ultimately, you need to have an integration between yourself, the therapeutic relationship, right, and a theory guiding your practice. Once you've established a relationship with the client, you need to know what to do with them to bring about healing. So the therapeutic relationship is super important. The theory is super important. You can't have one without the other. It's essential that the methods that you use support the relationship that is being formed and that the relationship is in alliance with the theory that you are addressing the case from. So throughout the semester, we're going to approach cases from different theoretical approaches, and we'll also consider what is your role in each of those theories and in each of those approaches to counseling. So thank you. Let me know if you have any questions.